Hi guys! Today we're going to be talking about clinical experience and how to get started. Clinical experience usually falls into two categories: healthcare or direct patient care. In this video, I'll be focusing on the latter, direct patient care. Now, if I started listing every single type of clinical role out there, we'd be here for an hour. So instead, I'm going to break down 5 of the most common and easy to get direct patient care positions that pre-med or pre-health students can pursue. None of these require any certifications. Number 1, patient care technician. Usually in this role, the patient care technician is helping patients with daily tasks like bathing, eating, going to the bathroom, and just taking their daily vitals. Number 2, clinical assistant. In this role, you're rooming patients, you're doing their vitals, you're doing their labs, any wound care, some minor treatments, and you're directly reporting to the provider. Number 3, mental health technician, also known as behavioral health technician. In this role, you're usually in an inpatient, psych, or rehab facility. You're helping monitor the patients throughout the day, you're leading some group activities, and you're just supporting everyone's emotional well-being. Number 4, medical scribe. Usually the medical scribe follows a doctor during patient visits and types up everything into the EMR system. Number 5, phlebotomist. Phlebotomists are usually just drawing blood in labs, in hospitals, and in clinics. Now, this might come as a surprise, but I've worked in 4 out of these 5 roles, all except patient care technician, so I can definitely speak on the good, the bad, and the ugly of each role. Let's start with my role as a clinical assistant. Now, this is where I probably had the most direct interaction with providers. I got to observe doctors, NPs, and PAs doing their thing, and that was pretty cool. I also loved how much patient interaction I had. Being the first person the patient sees means you get to really set the tone for the visit. And over time, you start to build some real patient relationships. The downside? It's fast-paced, you're juggling a lot, and some days it felt like I was just racing the clock. Next, I worked as a mental health technician. This role definitely gave me the most patient interaction. I was with them all day, every day. Leading therapy groups was one of the best parts. The downside? So I had next to no provider interaction. I didn't really meet the psychiatrist much. And it was probably the most mentally draining job I've ever had. You would have good days, but when it got bad, it could be so bad and scary that you kind of didn't want to come back. Next, let's talk about scribing. This was probably my most relaxed role. You're mostly by yourself and you're just documenting as the doctor speaks. But as you do this again and again, you really start to learn a lot about the treatment plans, about the common medications, and how providers make their decisions. The downside was that it was pretty isolating and sometimes it got a little boring. Lastly, phlebotomy. Now, I wasn't really a full-time phlebotomist, but in my float role, sometimes I filled in the lab, and that meant I was drawing blood back to back. And finding the vein and prepping the needle, it felt so cool. It was a big responsibility, and each patient put their faith in me. The downside was it was pretty repetitive, because you were just drawing back to back. And usually if you missed a vein, it would stay on your mind all day. So there was a continuous pressure to get it right the first time, every time. Anyways, that's about all I have for you guys today. Let me know in the comments which role you're thinking about, or if you worked in any of these yourself. And don't forget to like and subscribe if you found this helpful. Bye!